Good afternoon. My name is Latoya Lane-Milo, and I am a family nurse practitioner here in Florence, South Carolina. I have been a registered nurse since 2016, and I have been a family nurse practitioner since 2019. I started in the emergency department as a family nurse practitioner at the beginning of COVID, and I now work in an outpatient setting, taking care of COVID patients as well since July of 2019. I wanted to make this video for patients who may test positive for COVID, or people who have a loved one who tests positive, or just in the future, maybe it can help someone. I am making this video because in the outpatient setting, we get a lot of patients who have tested positive for COVID and just don't want to go to the hospital. Definitely in my community, but a lot of communities now, there's a lack of trust in facilities, just because there's been so much being said about COVID and facilities profiting off of COVID. So a lot of people don't trust healthcare providers and facilities. All I can speak for is when I was in the emergency department and the facility that I was working for, and I know we did everything that we could to save your life. And I trust that many other facilities and providers are doing the same. COVID is a virus. It's a self-limiting disease, so most people do fine, but there are some people who get secondary infections. The most common secondary infection that I've seen is pneumonia. So I am going to drop a few gems, maybe to help someone. If you agree with this video or enjoy this video, if you could share it, just to make it might touch the right person. So number one, and like I said, this is in an outpatient setting. This isn't someone who presents to the emergency department who needs emergency services. Number one on my list is don't panic. You were able to walk into that office, get that COVID test, and you were fine. You may have sinus congestion, headache, things like that. Your healthcare provider may give you something for that, or they may tell you to treat the symptoms over the counter. Neither one is incorrect. Just make sure that you go home, that you think about what's going on. You notify anybody that you were around, and don't panic. I know that's easier said than done, but you can beat this. Number two on the list is to quarantine. Make sure that you quarantine. This is for mostly the people who are okay. What I've been seeing is people who tend to do fine with COVID, they want to go out before their 10 days or 14 days is up. They'll go around people, not telling people that they have COVID, things like that. Make sure you quarantine. We have made a lot of progress in a year, a lot of progress. And as a healthcare professional, I can see it's a good bit of progress going on right now, but everybody has to do their part. Make sure that you quarantine when you're supposed to quarantine. Even if you're an individual who is in the house with someone who tested positive, be conscious of that. Be conscious of that. There's no telling when you could have picked up the virus. You may test early and then later on. DHEC recommends that you wait 7 days after exposure if you're not having any symptoms. So keep all of that in mind. Number three on my list is to take care of yourself. Yes, healthcare providers are there to take care of you, but it starts at home. We have to take care of ourselves, everyone. If you lose your taste and smell, or if you just don't have an appetite, make sure that you stay hydrated. Water is excellent, but give yourself something other than water as well. Give yourself some juice, real juice, some Gatorade, Powerade, something to give you a little boost of energy, because water won't do it alone, not if you're not eating. Also, if you're confined to a room, get up and walk around that room. Try to move a little bit. If you're confined to a house, that's even better. Walk around the four corners of your house, inside your house, inside your room. Make sure you walk around inside. Another thing is practice deep breathing. Everybody has a phone. Mostly everybody has the internet. Practice deep breathing. Do some deep breathing exercises. If you've ever had surgery, all of this was told to you before. If you had surgery, because we like to prevent pneumonia after surgery. And that's what we were trying to do with COVID too, to prevent pneumonia. Because like I said, and I'm in an outpatient setting, but the most common secondary infection that I've seen is pneumonia. So the last thing on my list is to listen to your body. Make sure that you're listening to your body. If this is for COVID positive patients, if you have a fever, and I mean a fever is typical with a virus, but if you have a fever 5 days in, 7 days in, and it won't break, you're taking all the Tylenol and Motrin in the house, and your fever won't go anywhere. If you're taking a deep breath and you can barely get air in, or it's so painful that you can barely take a deep breath, listen to your body and go get evaluated. I'm sorry, healthcare providers, if I'm going to be sending you extra people, but that's the main thing. You have to get help early. Go get your help early, so when you do present to the emergency department, it's a simple treatment, outpatient antibiotics, steroids, whatever it may be, maybe infusion services. But just make sure that you go get treated. Don't try to treat yourself at home. I know I can't speak for every healthcare provider, but I will say, if you get treated early, if you go as soon as you feel like, okay, I'm getting worse, my body doesn't feel right, I'm not getting any better, 7 days after, you should start feeling a little better. If you feel like you're getting worse after 7 days, you need to get evaluated. And I don't mean, oh, I still have this headache. I mean, like, I can't breathe. Like, my chest is tight. Like, I can't get any air in. My fever won't go anywhere. Something like that. Please go get evaluated. Even in the outpatient setting, just go get evaluated. Even if it's just go get a simple chest x-ray. I'm not saying what a healthcare provider will do for you. I'm just speaking for myself. You may go to an urgent care and they say you need to go to the emergency room. Just go to the emergency room. But you need to get evaluated. If you've tested positive, and like I said, I know everybody has their reasons, but we have to think about each other. If you know somebody who's tested positive, check on them. Text them, call them. Just check on them. Say how you feeling today. Are you short of breath? Have you gotten up and walking around the room today? We have to pull together. We're going to beat this. We are going to beat this. It's turning around, but we just have to keep the ball rolling. We're going in the right direction. I'm going to drop another video soon talking about the vaccine. But just for this one, I just want to make sure that I got this word out. It was on my heart for a few weeks, and I just needed to get out. Love y'all.